Hey everybody, this is Danny Lewy. I'm here with Tracy, my marketing director right here. And we got Q with us. Q is a patient, former patient of ours, and we want to talk to Q today about how she did with physical therapy, how she liked physical therapy, what brought her to Lewy Physical Therapy. So we're going to have a good fun podcast here, real laid back, and we're so glad Q wants to join us over here for this podcast. So thank you, Q, for being here.
Thank you guys for having me.
So Tracy, well, let's start out this though. Ask Q a few questions, and you can start out asking one or two questions.
All right. Well, really what I'm curious about is what got you into therapy in the first place? What was going on?
Well, unfortunately, I was in an accident, a car accident. Car totaled, everything damaged.
That had to hurt.
Yeah, definitely hurt. And I was referred to PT, came over here. I'd passed by a few times, and I've known the area for a little while, and started treatment, and it was great.
So your car wreck, were you hit from behind? Were you driving? How did it happen?
It was a T-bone situation.
Ooh.
So I end up being like in the side of someone else's car in front of me.
Did your airbags go out?
Oh yeah.
They did? So it's
yeah.
pretty bad, right?
Yeah, it broke my glasses.
Holy moly.
Did you stay awake during the whole thing, or you were knocked out?
I did, as far as I know. Yeah, I think I stayed awake the whole time.
Must have been terrifying. So sorry to hear that.
Terrifying.
So was it hurting all over, or just in localized places?
Nah, mainly just neck and back areas, maybe a little in the shoulders, but that was about it.
Okay.
It wasn't too crazy, but considering I'm young, I wasn't used to that. It was weird.
Yeah.
And was it bad enough that the ambulance came and got you and brought you to the hospital, or you just went?
Well, I was a little busted up, but I said I was fine, so
Okay.
I just kind of left.
So normally sometimes in therapy you see patients, we talk to patients, and again, this is our 20th anniversary.
Yeah.
So we've seen a lot of patients come through here, but a lot of patients say it takes maybe a day or two to really start feeling pain. So when do you really start feeling the neck, back pain after the wreck?
It was about a day, at least a full 24 hours, because that evening I was like, no, I'm fine. I'm good. I'm great. And then the next day I was like, okay, no.
Yeah,
I definitely got in an accident.
I think a lot of that happens with adrenaline. Adrenaline's really going on. You're really just aware of everything, and then when it wears down, you start feeling the pain. I believe that's how it happens a lot of times. Did you go to the doctor after that, or you see somebody, or you just referred us for therapy? How did it start? How did it start?
I went to an urgent care.
Okay.
And then they did a few x-rays. They said the x-rays are fine, but you have some swelling, you have some of this, some of that. So they gave me anti-inflammatory medicines, and then they talked about PT for a little bit.
And you said you were hurting. Were there things that you could not do and day-to-day?
Absolutely. As far as bending, I couldn't do a lot of bending. I was really stiff, really sore. So it was almost like the things that I would usually do, like sports, just goofing around, I couldn't do it.
Sleeping, was it affect your sleep?
Oh yeah.
You did?
I would get a couple hours of sleep a night, if that.
So you were off your normal way of living, obviously.
Oh, yeah.
You were doing fine before the wreck, and this wreck happened, and bam.
Everything's changed.
And in Baton Rouge, it happens. I wonder how many wrecks we have a day in Baton Rouge. I mean, it happens so frequent.
I feel like it's a big number.
I would think it'd be a big number too.
Yeah.
For sure. So when you start therapy, how'd it go? Well, tell us a little bit about we're talking to people out there might be wanting to go to physical therapy. So tell us a little bit what happened when you started there, the little kind of process, what happens.
So it's not just going to the gym, which I
You
was
thought-
under the
a lot of people-
impression that it was just, I'm just going to the gym, just working out.
And a lot of people think that too.
Yeah, it was very detailed. Like,
What do you mean by
whatever's-
detailed?
Whatever's going on with you, like if it's a knee, a shoulder, or whatever it is, there's a lot of muscles in that area, a lot of bones, a lot of ligaments, and it's almost like they know how to treat every single one of them. So whatever is happening, the exercises, the stretches that you do, whatever specialties people have, they'll get to you.
And a lot of times when in a wreck, talking about your knees hit the dashboard a lot of times. It causes pain to the knee, and vice versa. Even the seatbelt will cause pain to your chest because you're thrown forward and the seatbelt's pulling you back.
Yeah.
So a lot of ways, even though those are safe precautions, they can also make you sore too. The airbag hitting you in the face can cause neck injuries and neck whiplash type deal. So all that, and again, like I said, it takes a day or two to really figure out, hey, what's hurting on my body? And that's what therapy, I think, is good for, because they kind of can analyze where you're hurting, what's your number one pain point, number two pain point, number three, and work around that.
Oh, absolutely. And I think when people have specialties, you don't really know what to expect because I don't like needles, but I did dry needling.
Yeah, how was that? 'Cause
It was scary at first. I almost passed out because I was just really nervous, but it turned out that it was probably the best thing I could have did for my muscles.
really?
Yeah.
So was it just the idea of it that was so scary when you said you almost passed out? It was just the idea? Or?
Absolutely.
Okay.
It was just me being afraid of needles in general.
Okay.
And I think every time I've gotten like a chicken pox shot or something, I've passed out.
And that's real common with patients. 'Cause, I mean, everybody's kind of scared of needles, but and I'm certified in needling as well. It's just the needles are so fine. You can feel a tiny little
It's
pinch.
like the tiniest prick.
Yeah.
Yeah.
But the theory of it is, I think, very sound because it reduces the tension on that muscle, and your muscle attaches to a tendon. The tendon attaches to the joint. So when you relax the muscle with the needle, it takes stress off the joint. So it makes sense what it could work. But it's a little bit uncomfortable. But again, if that being a small pain point is not as bad as probably the pain you're in already. So it really is beneficial.
Ended up being dry needled at least one time a week.
But there you go. See?
Yeah.
So that's good. And
Was it all in the same place? Because I know you had multiple injuries. So were they doing that in, your back, your neck, and different places, or it was all focused in one spot?
I think I had like two main places. So it would be like my traps mainly because those would get really tight for me stiffening my neck up.
Mm-hmm.
And then I had my lower back. So right on like my waistline, that's where they would dry needle as well. But it's mainly just those two places.
Okay.
now in therapy as well, did they show you exercises, and you were doing exercises in the clinic, and then they showed you stuff to do at home as well?
Yeah, they give you like a list of exercises to do at home, which are pretty much the ones that you do in the clinic, but you do them like unassisted.
Mm-hmm.
So if you're doing those correctly at home and you're doubling up when you come in, it's fantastic.
That's good.
Yeah.
That's really good. And they put a lot of therapy, people think of therapy, like you said earlier, going to a gym. But to me, what separates physical therapy is putting your hands on somebody, stretching, doing soft tissue work.
Yeah.
They did needling is part of that as well. But we do a lot of different things here at Lewy PT, cupping, taping, different. So some other things we've done too besides needling as well.
Yeah, I've actually had both of those, the cupping and the taping.
Really?
I've had that, and I think the Hivamat.
Okay. Now the Hivamat, we got to tell the audience what the Hivamat is. You want to explain it, or I can explain it, or?
I mean, if I explain it, it's not going to be technical. It's basically baby powder on you and just like really high frequency. It just feels like vibrating, but right after is really good.
Yeah, and it's really good for drainage, lymphatic drainage, and reducing pain for sensation. Because actually the therapist has a glove on, and they'll do soft tissue, but the stimulation is going through their hand, which is really unique. And the patient is holding like a wand, so that the whole circuit goes through the patient and the therapist. It's really comfortable, and it feels great for swelling. It really is. Patients love it. Yeah. So that's a great thing that we offer here as well. Now, one thing too at Lewy Physical Therapy, we offer aquatic therapy.
Yes.
Big pool, but I don't know if some patients don't need a pool. Normally, aquatic therapy for patients that are really severe pain, can't do as much on land, so we put them in the pool. Was that your scenario, or what?
I did not get in the pool. I was walking pretty fine, so I don't
so you
think
didn't actually need it.
Yeah, I don't think I needed the aquatics. I also can't swim, so.
But which does not matter at Lewy PT, because we get people in the water with you for non-swimmers, and
Yeah.
so it's not an issue with that either. And the water is great for. But again, if you don't need it, we ain't gonna push it on anybody. But aquatic therapy is such a great avenue for people with therapy.
Oh yeah.
But so therapy with you, you had fun. It wasn't like going to the doctor. I mean, I say doctor, you need to go doctor, but it wasn't. It was a kind of fun experience to go to.
Yeah, I would be coming here a couple times a week, having a blast, doing my exercises and things. So it was definitely fun.
So are you mostly back to where you were prior to the accident?
Yeah, I have all kinds of activities lined up. I have vacations and everything. So yeah, I'm definitely way better, way better than when I started.
Oh, that's good to hear. That's definitely good to hear. So I'm kind of fascinated by the cupping. I've never had that done. The first time that I saw that was in the Olympics. Remember they had all the, I think the swimmers with the circles and stuff on them. So what was your experience with that? Did you think that helped, or what did it feel like?
It did relieve a lot of like muscle tension. So they would move the cups around, they would hold them there. So depending on, I guess, what you needed at the time. But at first it looked a little weird But after having it done the first time, I was like, okay, this is also something that's working for me.
Oh, that's great.
The cupping's been around a long, long time. It's good for tissue damage, pain, drainage. You find trigger points, you put that cup right on top of that trigger point. And it does sometimes might leave a little redness or red spot on you. It looks a little strange. But it's really good, actually. We use cupping, this little off topic here, for plantar fasciitis as well. You can put it on the bottom of the foot. And like Q was saying, you can push it up and down the foot, which really stretches the plantar fascia. Not saying you have plantar fasciitis, but you can use cupping for a lot of different things. And you get good relief with it, you know?
Yeah.
How about taping? Did they do tape on you? Or
they did taping.
Which is different as well. I mean,
yeah. I have terrible posture. So while I was recovering, me fixing my posture was a really big deal. So I would get taping to kind of assist with that, kind of move my muscles how they were supposed to go, like kind of set them there. And then when I would do my exercises, it would reinforce that. So it helped a lot with just movements all the time, just kind of keeping me where I'm supposed to be in the right positions.
Well, I'm loving how your experience came at Lewy PT. That's great. And we didn't tell you to say anything here. You're doing great. This is great. Because now when you were going to your last treatment, like discharge time, did you were discharged and they went over your progress with you? And also, did it, like midway through your treatment, did they go over like your progress throughout your treatment?
Yeah, they would let me know, especially with the reevaluations. They would kind of let me know, like, hey, you're doing good today. Like,
so tell us a little bit, a quick thing about what's a reevaluation. What is it?
Reevaluation is almost like a check-in appointment. It's almost like you start, you go a few weeks, and then they kind of check in with you, redo your measurements, track your progress like a little more literally. And then, because every time you do a treatment, they ask how you feeling, what's going on today, and
very good.
Like that,
so that's great to know. It's great for the therapist to know that, and great for patients. I think it helps the patient just think about how they're doing their progress, which is good. It's like a check-in.
It was nice.
Yeah, and the same kind of with the discharge, the same type deal, or
it was basically like, hey, you know, like you've done your paperwork for today. It's looking really good. How do you feel? Is there anything that you think you need to work on? And then I was done.
Great. That's so you had a great experience.
Yeah, I had fun. I had a great time. I want to come back, but I don't want to get hurt to come back.
Yeah, we don't want you hurt.
Definitely not.
Yeah.
Don't we get no more car wrecks, please?
Yeah.
I'll try my best.
So you said you had some vacations and activities and sports stuff coming up. Like what?
I play a lot of basketball, just like on the weekends. I can do that again. I do plan on going to like a few concerts, and that's a lot of standing, which I wasn't able to do for like previously. So far, that's probably about it.
All right, you're going to do that crowd surfing?
Probably not. I'm afraid of heights, and I'm scared somebody would drop me, and then I would be back here, which isn't a bad thing, but
that's a good point.
I'd be scared of that too.
Yeah.
I'm not that heavy though.
What kind of concerts you like?
All kinds.
Really?
The exciting kind.
You don't like old school like I like? You don't like Van Halen or?
No, I don't know who
Yeah.
that is.
Oh. Well, anything else? Now, what would you tell people that need therapy? So say somebody you know needs physical therapy. What would you say? How would they get here, or what advice about physical therapy?
First and foremost, do not be afraid to do therapy. It sounds weird when people kind of give you details about it, but when you go through it, it is phenomenal. So definitely don't be afraid to do PT. As far as like getting set up and everything, if you're having the slightest of pain before you do things like MRIs and all that kind of stuff that just kind of eats away at your bank account, I would try PT. PT is definitely a course that people should take if they're having any kind of pains.
Right. And definitely probably contact your doctor as well, just to make sure. And look, again, Lewy PT, we've been around for 20 years. Tracy's been with us a long time, so all the doctors around to know of Lewy Physical Therapy. So I think anybody out there needs physical therapy, just ask your doctor about Lewy Physical Therapy.
Yeah.
Definitely.
Anything else we need to ask Q while we got it here? Favorite food, Q?
Cereal.
Okay. So what kind?
Yeah. Cereal and milk. There's only a few that I don't like, but everything else,
Fruit Loops,
I like
Lucky Charms.
all of it.
Anything with cereal, sugar.
Yeah, pretty much.
Okay.
I like Special K though.
Oh, that's
it's not
good.
Yeah.
It's kind of healthy.
Yeah,
It's kind of healthy. Yeah. So, okay, favorite restaurant in town?
That's difficult.
It is hard. There are a
I'm
bunch
not
of good
sure.
ones.
Yeah. I'm not sure
got
on
our
that one.
spot.
I'll have to think on that one.
Best favorite movie?
I would say Nobody.
Never heard of it.
It's like an action movie.
Yeah, okay. Well, now I've got something to look up on Netflix.
Oh, yeah, absolutely. Is it on Netflix? It may be.
I'll find out.
Yeah.
All right, Q. Well, look, it's been great having you, and we appreciate you coming to physical therapy and being, a lot of times it's being consistent with your therapy. Thanks for doing that and getting better. We love it. We love getting patients better out there in the world, physical therapy.
Absolutely, yeah.
And appreciate you taking time to come here and talk to me and Tracy as well.
Yeah,
Oh,
thank
for
you
sure.
so much.
No, thank you guys. This was great.